Welcome back to another video. If you've never seen my videos before, my name's Erica and I'm currently an OBGYN resident, and today I'm bringing you another vlog. I did want to provide a warning up front that I will be talking a little bit about pregnancy loss during this vlog, so if this is a topic that is too fresh or too painful for you to hear about, here are the times of the video that you should skip. First up for the week is contraception clinic. We see a wide variety of patients in this clinic. While some patients come for annual GYN wellness visits and others come for acute complaint visits like vaginal discharge or STI testing, most of the patients that we see in this clinic present for counseling on or management of contraception. Within this specific focus, there are still a really wide variety of patients that we see. Some patients have never been on any form of birth control before, and they present to get education on and also counseling about contraception. Other patients are really medically complex and they may even have contraindications to certain types of birth control, or they have additional risk factors for certain birth control and need more extensive counseling about their options. And still others present because of complications regarding their contraception. For instance, while a majority of IUDs or intrauterine devices function without any issues, some patients are referred to this clinic because of IUD has become embedded in or perforated through the wall of the uterus. This is a very rare complication, happening much less than 1% of all IUD insertions. But when this does happen, patients are often referred to this clinic for management. Similarly, we also see deep Nexplanons. The Nexplanon is a contraceptive implant that is inserted into the arm. Again, rarely, less than 1% of the time, the Nexplanon can be difficult to remove if it's too deep. This can happen if the initial insertion was performed too deeply, or if a patient happens to have an increasing amount of subcutaneous or fatty tissue in that area over the course that the Nexplanon is in place. Again, these patients get referred to this clinic, and often these difficult removals can be done in the clinic under ultrasound guidance. Today is another clinic day, but today I get to see my own patients in my continuity clinic. Since it's a general clinic, I see a huge variety of both obstetrics and gynecology. Today I saw a patient for a postpartum check. Just a few of the many things that we review with postpartum patients are, number one, how are they recovering physically, including checking their vitals, performing a physical exam, making sure that their bladder and bowel function are normal, and that their lochia or their postpartum bleeding and discharge is minimizing or has completely resolved, depending on the time frame, and checking in with pain associated with their delivery, whether it be a C-section or a vaginal delivery. And then number two, how they're doing emotionally. The postpartum period can be particularly difficult and vulnerable and tiring, and so it's important that I screen for postpartum mood disorders as well as review normal expected mood changes and swings versus something that I'd be more worried about and something I'd want them to see me back in my clinic about, or even provide a referral for something like perinatal behavioral health. And number three, I always address infant feeding, so making sure that they have the right resources, whether it's formula, a breast pump, or a lactation consultant, as well as counseling on the many different methods for contraception, and ensuring that we can support our patients to best meet their family planning goals in the healthiest way possible. Another day, another workout. As you've probably seen in my recent videos, I don't necessarily work out every day. The general recommendation for physical activity for adults is at least 150 minutes of moderate intensity aerobic activity plus 2 muscle strengthening activities per week. But talk to your doctor as each case is unique. That being said, I try to work out at least 3 to 5 times a week for 30 to 60 minutes a session. I typically alternate or do a combination of resistance training and cardio. Since I did a cycling class on my knockoff Peloton earlier this week, I'm going to do some weight training today. And then I'll follow this up with a cool down walk with Bama. After showering and getting in some cozy sweats, I'm sitting down to study for an oral exam tomorrow. This is a low-stakes board-style exam that we do as an introduction and as a practice to what we'll eventually have to do for our board exams. Also, peep my study buddy right now. So cute. Cue a quick outfit change. So this morning I was supposed to have a case, but unfortunately it got canceled. The silver lining is that I got a little bit more of the morning off, which is good timing because tomorrow I have my exam. Now I am ready to go into work. We do have a procedure called placing lambs or laminaria, and I will explain what that is in just a little bit. I'm heading over to the hospital now, and the first thing I need to do is collect all of the supplies needed to safely do this procedure. Laminaria are sticks that are actually made out of dried and compressed seaweed, and they're used as osmotic cervical dilators. What that means is that we place them within the cervical canal, and they work by absorbing water from the surrounding tissue and expanding, as well as by causing release of prostaglandins. Today, we're placing them for a patient who has unfortunately had a pregnancy loss during the second trimester. One of the ways to manage pregnancy losses that occur later on during pregnancy, as in this case, is by performing a D&E, or a dilation and evacuation. In order to remove the demised pregnancy safely, the cervix needs to be dilated, which can be accomplished by a combination of prostaglandins such as misoprostol or Cytotec, laminaria, mechanically, and most often a combination of the three. Today we place the laminaria, sometimes referred to as lambs, and we will leave them there overnight and plan to complete the procedure tomorrow. So when I initially made this YouTube channel, it was really to show people what going through medical training is like, and specifically what being an OBGYN resident is like, and if it is a specialty for you and that you would want to go into. And I know I share a lot about kind of the high points of this specialty, especially when I'm on labor and delivery and we're having exciting deliveries and happy endings. But one of the realities of my job as an OBGYN resident is that there are a lot of sad times. 100% you are there for some of the best times of people's lives when you're delivering their babies, but you also are there for some of quite literally the worst days in some people's lives. And pregnancy loss is extremely complex for so many reasons. Obviously, as the doctor, as the provider, you are there to manage the pregnancy loss and to help people stay safe and treat the loss. But you are also the person that is breaking this news to them. And I remember the first time I diagnosed a pregnancy loss, just trying to find the words to use to explain what's going on, and knowing that the words that were about to come out of my mouth would be some of the worst feelings that that person has ever felt. And I think it's really important for people who are going into this field to realize that, yes, you are there for the highs, but you're also there for a lot of the lows. And sometimes people come in and they have a suspicion that they've had a pregnancy loss because they've noticed vaginal bleeding or they are having decreased fetal movement. But sometimes someone is coming into the clinic for a routine appointment and you are getting Dop tones, you can't find them, you grab an ultrasound, you don't see any fetal cardiac activity, and that is how the loss is diagnosed. It is something that no one expected to happen. And you have to switch gears from being excited to see your patient again for another prenatal visit to telling them again something that could be potentially the worst news that they've ever heard. And that's really hard. It's really hard, and I would be really interested to hear what, if anyone watching this has experienced a pregnancy loss, what you feel like your provider did or didn't do that could have made you feel more supported in the process of a pregnancy loss. And as a resident, I have seen my attendings counsel people, I have counseled people myself, but regardless of that experience and that exposure, it is never easy. And I am just really interested in learning from you guys who are watching and who might have had this experience, unfortunately, what we can do as providers to be better and to make you feel more heard and cared about, and just how we can even better support you through this process. I absolutely love my job, and obviously it is easier to emotionally cope with and feel satisfied after a good outcome. But when pregnancy loss happens, even when it is hard and it's painful for the patient and it's painful for you as a provider who cares so much about that patient, no one wants to diagnose a loss. There's also something that is fulfilling about being the person that is there for this patient in some of their hardest hours. All of that being said, I think that this is part of the job that isn't talked about a lot, that is not an uncommon experience that you will have to have as a OBGYN provider, that I think is important to know and understand before considering going into this field. Today's my last day of work before I go out of town with my class for our class retreat. However, on a more somber note, today we will complete our patient's procedure. While overall the physical recovery from this procedure is typically quick, we recognize that pregnancy loss takes much longer to recover from emotionally. We try to support our patients in as many ways as we possibly can by not only taking care of them from a medical and surgical standpoint, but also by being a listening ear, connecting patients with bereavement support people, including the hospital's chaplain, and even trying to find ways to help honor their pregnancy, like by making footprints for patients to keep. After the procedure, I went to our resident workroom so I could work on a PowerPoint for an upcoming presentation, while also staying close by, just in case something came up for our patient during her recovery phase. After our patient completed her recovery, we were able to safely discharge her home. Thank you guys so much for watching this video. I'm headed out for my class retreat now, but I'll see you on my next vlog.